to live a healthy life inside and outside. आज जरा outside की बात होगी, which is of course a trillion dollar industry, जहाँ पर आप अच्छा फील भी करना चाहते हैं, अच्छा दिखना भी चाहते हैं, लेकिन उसके लिए थोड़ी सी मेहनत होती है और कभी कभार वो मेहनत हम खुद करते हैं, कभी कभार हमें इतने अच्छे डॉक्टर्स मिल जाते हैं जो हमें ऑफ कोर्स इसमें हेल्प करते हैं। और आज जिस तरह हमने आपको बताया, डॉक्टर विमी हमारे साथ होने वाली हैं। डर्मेटोलॉजी की बात आती है, मेरे जहन में सबसे पहले हमारी त्वचा आती है, जिल्द आती है, स्किन आती है। क्या डर्मेटोलॉजी इसी का नाम है या इसमें और डिटेल्स हैं? क्या हम कुछ मिस तो नहीं कर रहे? ये सारी चीजें हम पूछने वाले हैं। यू मोर देन वेलकम टू गेट इन्वॉल्व, वी लव टू हियर फ्रॉम यू ऑन 0586861003. It's time to get started with more healthy information, all courtesy MedStar on Talk Breakfast, Talk 100.3.
This is Talk Breakfast with Vivek Sunil and Sobia Khan on Talk 100.3.
And Dr. Vimi, very happy to have you with us. Please, आप माइक के करीब आ जाइए। आप माइक के करीब आएंगी तो लिसनर्स के करीब आएंगी, एंड लिसनर्स भी आई एम श्योर बिल्कुल करीब होना चाहते हैं। डॉक्टर विमी, जैसे जैसे टाइम आगे बढ़ रहा है, हम ख्याल नहीं रख पाते हैं बहुत सारी चीज़ों का जिसमें हम खुद भी ऑफ कोर्स उसका हिस्सा हैं, एंड ऐसे में फिर आप जैसे स्टार डॉक्टर्स फ्रॉम मेड स्टार हिस्सा बनते हैं टॉक ब्रेकफास्ट का और लाइफ को आसान करने की कोशिश करते हैं। एंड ऑफ कोर्स डर्मेटोलॉजी एक आई थिंक काफ़ी डिटेल टॉपिक है, लेकिन मैं हमेशा ये सोचती हूँ डॉक्टर विमी कि डर्मेटोलॉजी इज़ ऑल अबाउट स्किन। इज़ इट मोर, इज़ इट लेस? एम आई राइट, एम आई रॉन्ग? समवेयर इन द मिडल, ये आपने हमें बताना है। बट सबसे पहले आपका स्वागत है। गुड मॉर्निंग।
Good morning.
Was it easy to come here, reach here today?
Yeah, it was
राजश्री
very easy,
को पार्किंग मिल गई थी।
Yeah.
Excellent. So बताइए डॉक्टर कि what dermatology means, what it's all about.
So, being a dermatologist, we do treat patients with skin problems, not only skin, but also nail and hair problems. So, of late, like we are seeing more, there is a trend in Dubai.
So starts with skin, hair included, nails included. Okay.
Yeah. So along with that, now there is a recent trend in Dubai that people will come for more facial treatments to look younger, for the younger look. Yeah.
क्या facial वाकई हमें help करते हैं और it's just a feel good factor?
No, like not only the facial, there are more into it. We do as a dermatologist, we can do more about it.
Skin tightening and anti-aging.
Yeah. For the glow, we have mesotherapy, facials. Then you have to go into details if you have a concern. Say for example, if you have a pigmentation or something like that, you can go in for chemical peels, mesotherapy, and also to take care of aging factors also. Like anti-aging treatments are also there. So early aging, we can easily target with treatments like facials and mesotherapy. When you have some concerns like wrinkles or sagging of the skin, we have Botox, we have fillers. I, as a dermatologist who is practicing, mostly into this anti-aging services, I generally tell my patients to go in for treatments which will stimulate the collagen. Collagen is the good protein in our skin, which is getting reduced as you grow older. So you have to do treatments to improve the collagen in your skin.
बिल्कुल डॉक्टर विमी, हमारी ग्रैंड मदर्स यखनी बनाया करती थी, ये जो वेजिटेबल स्टॉक हो गया या मीट स्टॉक, वो अब कहाँ टाइम है हमारे पास। तो ऐसे में डॉक्टर विमी बिल्कुल अवेलेबल है। इसी के बारे में पूछेंगे, बट क्यूरियस टू नो, आपको यहाँ 9 साल हो, 2009 से आप
2009 से मैं यहाँ पे हूँ।
So yes, quite many years to talk about the trends among people here. सबसे पहले तो ये बताइए कि how popularly people are concerned about their skin. Are they very very worried? आपके पास कितनी कम एज से आपने एक्सपीरियंस किया अपने पेशेंट्स या क्लाइंट्स?
So yeah, people are coming. Like usually for females it is the early 30s, and for males early 30s, and then for males you can say like 10 years later, like early 40s. Yeah, it's like that.
Okay.
So yeah, that's how the skin age also, because the
30s
females,
is the new...
we are going through all the stress, pregnancy, hormonal factors are changes are happening in our skin. that you see early signs of aging, like under eye darkening, fine wrinkles around the eyes, like
अच्छा
that. So
मैं
yeah.
सरप्राइज हो गई कि 30s में, क्योंकि शायद 30s इज द न्यू 20s.
Yeah.
तो लोग जो हैं वो ख्याल रखते हैं. एंड व्हाट इज द रेगुलर यू नो रिक्वेस्ट आपको आती है कि मेरी स्किन ऐसे कर दीजिए जैसे फोन पे फिल्टर होता है, बिल्कुल
So
स्मूथ
now
एंड
people
ग्लो.
are more into regenerative medicine, like no looking to do treatments and to look good, and then natural treatments, like no, it shouldn't be like less invasive. It should be a safe treatment to do.
Okay.
So in that comes PRP, the platelet-rich plasma treatment, wherein we take your own blood and you centrifuge it and putting it back onto your face. Like
Okay.
we put injections and all, gently we roll it with Dermapen. That is a very common treatment that you do for skin rejuvenation, which is the safest of all the treatments.
एंड हाउ इफेक्टिव इट इज. अपीयरेंस में कितनी जल्दी आप चेंज देख
So
सकेंगे?
usually we say like 3 sessions once a month that we do it. After a single session also you'll see
You
the
feel-
glow aa jata hai face mein.
अच्छा.
Yeah, that freshness is there. And then when you start with some like you know anti-aging creams, like I have creams containing vitamin A or vitamin C, that will add on to it.
So
yeah.
3 months usually, but
Yeah,
you see the
once a
difference?
month. Yeah,
Like
once a month, and then that the 3 treatments we do over a period of 3 months can be maintained with daily skincare routine that you follow, like a good cleanser, moisturizer, and sunscreen. Sunscreen is the best anti-aging cream. That's what I would say. Like no, our skin is getting exposed to sun all the time, so you have to protect your skin from sun. So you have to use a good, you have to choose a good product which suits your skin, and then you have to put it liberally onto your face and the exposed areas. Half an hour before you go outside in the sun, you have to put it.
And for
It's like
men
that.
and women,
Yeah.
both,
Yeah.
Dr. Vimi,
Yeah.
what age do you suggest? Of course, approximately age
Okay.
that they should start visiting a dermatologist, and they should have a family dermatologist.
Yeah, say early 30s, I would
Early
say
30s.
early 30s.
Okay.
But always
It's
like
recommended.
yeah, it's recommended.
But if you are under the sun, maybe the
So,
nature of your work.
anti-aging, you sunscreens you can always start from the beginning, like no, like
it
even early
teenage?
teenage, of course you have to protect your skin from sun.
Because so much
So
of sports we
protection-
love to play, we
Yeah,
love to
so-
swim under the sun. and-
Exactly. So that sunscreen you can start early, and then slowly you can start with some vitamin containing vitamin A, vitamin C, vitamin E containing creams to begin with, and then goes the hydrofacial or the oxygenofacials. There are facials which remove the dead skin, and then when you put the cream, it works on the deeper layer of the skin.
So,
Yeah.
Dr. Vimi, anybody can do it, or it's only for the brides?
For the facial is for all skin types. Anybody can do it.
We want to look like a bride every day.
That is.
And I'm sure grooms as well. Rachri is wondering कि why she missed on the grooms, but because ज़ाहिर है वो भी आजकल मेकअप करती हैं डॉक्टर विमी, तो फिर क्यों ना अपनी ट्रीटमेंट भी कराएं, वो जो एक चेहरे
And
पे glow रहती है.
natural, and then safe treatments to do. So
तो ये तो था under dermatology umbrella. We are talking about the skin, and of course Dr. Vimi mentioned you've got facials, you've got creams and anti-aging, and of course the Botox and all. We all have some information, and each case is different, so of course that is going to be very lengthy. I would also like to bring in what all MedStar has to offer when it comes to hair, Dr. Vimi.
So for the hair treatment, we have PRP. So basically for females, mostly it's like a vitamin deficiency that can cause hair loss and thinning of the hair. So that has to be ruled out, especially in the case of females. And then you can do mesotherapy. We infuse vitamins onto the hair, improves the hair follicles, and then the PRP treatment,
Sure.
which will rejuvenate the hair follicles. For males, 80 to 90% of cases, it's the male pattern baldness that they have.
Yes.
So there, the PRP treatment.
Any improvement on that in that regard, Dr. Vimi? Has
When
it
you
got
start
better?
early, yeah, of course, when
Early.
you have that early thinning of the hair, when there is complete hair loss, then there is no scope for any treatments. There you have to go for hair transplantation.
Sure.
That also you have to start when you have that donor area, the hair should be there.
Okay.
So early you start with any, if you see an early sign of this thinning of the hair, you can start with PRP. There are hair growing lotions that we recommend along with the PRP treatment.
Because it's case
So-
to case, so you need to see the
Yeah, exactly. So the
patient.
PRP treatment, as I've already said, like it is a 3 sessions to begin with. Then you have to maintain it twice a year or so. When apart from that, we have a new treatment called the Regenera Activa, which is a very good treatment, like wherein it's again a like same regenerative treatment, like wherein like we, instead of the blood, we take the skin tissue and then we crush it and put it onto the we have a special machine for that. The Regenera Activa is the latest treatment that we have for thinning of the hair.
Sure.
Yeah.
And of course, you must be having some of the other creams and treatments for long hair, वो लंबी जुल्फें, extensions लगाने की जरूरत ना पड़े, wigs लगाने की जरूरत ना पड़े, वो भी is of course a part of it. Do people come for that as well? कि मेरे बाल grow नहीं हो रहे, उम्र बढ़ रही है और बाल नहीं बढ़ रहे.
So we as dermatologists, we treat the hair problems. So what is the concern has to be targeted. We have to do blood check and then go in for treatments.
Okay.
Yeah. So.
And that is something that takes us to the next category of dermatology, and that is nails.
Okay.
So what all do, is it for children who bite their nails or elders?
It comes all problems.
Is there a solution to it?
Pardon?
Is there a
so nail, like when you see the nail disorders, it can be sometimes a problem that is a serious problem, like thyroid problems can cause thinning of the nail and break the brittle nails. So it's a manifestation. The nail problem could be a manifestation of any like serious problems that you have in your body. That is also there.
Dr. Vimi, before we head towards the sports break, इन्होंने अपना नाम नहीं लिखा, लेकिन ठीक है, कोई बात नहीं, क्योंकि बात बालों की हो रही है. वो ये जानना चाह रही हैं या जानना चाह रहे हैं कि any solution for early grey hair?
Early grey hair, which is
लेकिन है मतलब हों जवान लेकिन लगे बूढ़े, क्योंकि बाल जो हैं वो सफेद हो गए.
So it's a very common problem nowadays. Maybe like unfortunately there is no 100% cure for it. Yeah, so if you have any deficiencies like vitamin B12 deficiency, vitamin D deficiencies and all, sometimes you will start early graying of hair and it will be very progressive. So in those cases, we will supplement with some vitamins so that the progression will be less. Like, we can control the graying of the hair, but we cannot completely reverse the process. Yeah.
Sure. Okay.
Yeah,
Thank you so much for your query. And Sajid हमारे साथ हैं. Sajid जानना चाह रहे हैं कि what is the best treatment for eczema? My wife has eczema since almost 8 years now, more on her feet, doctor.
Okay, eczema, it's a chronic disorder. We cannot completely cure the problem, but definitely we can get it under control with the creams and some medications. So you have to go to a dermatologist to see how severe it is. The doctors will give you anti-inflammatory creams.
So 8 years, agar wo chal raha hai silsila, and mainly on her feet. So I'm sure.
So we can get it under control. Actually, there are creams like immediately the itching, eczema, you develop redness, itching, everything.
Sure.
So with the creams you can get it under control. Symptomatically we can cure it, and then to prevent the recurrence, we will give some other creams which is safe to continue. So in that way we can get control on this eczema problem.
Fantastic. Trying to control as many problems as we can, thanks to Dr. Vimi, talking about everything that is under the sun when it comes to your skin, your hair, your nails, anything you want to know, more than welcome to join us. And meanwhile, sports break ka bhi silsila jari hai. The number is 0586861003. इस पर आप of course डॉक्टर विमी से पूछ सकते हैं. कोई स्किन इशू है, आप चाहते हैं कि योर स्किन लुक्स बेटर, एंड कहते हैं बुढ़ापे से हम बच तो नहीं सकते, उसको डिले कर सकते हैं. तो ये कुछ मैजिक जो है डॉक्टर्स के पास है आजकल, एंड दैट्स व्हाई डॉक्टर विमी फ्रॉम मेडस्टार इज वेरी मच हियर विद अस. क्विक ब्रेक और उसके बाद फिर से वापसी. सुनते रहिए टॉक ब्रेकफास्ट ऑन टॉक 100.3.
Talk 100.3.